in?
All right, we are now live. Navira, up you go.
Okay. Hello, everyone. Welcome back to Fresh Dental Shadowing. Today we have another amazing virtual session for you guys. We have Dr. Ayzin. So he's just going to start the virtual session now.
All right, well, thanks for having me, guys. My name is Dr. Ron Ayzin. I'm 27 years old, so I'm not too far removed from you guys. I'm a general dentist in Newport Beach, California, and I really exactly know where you guys have been. I remember it like it was yesterday. So I'm happy to answer any questions or concerns during the time. I do a lot of general cosmetic and implant dentistry, and I'm happy to talk about it. And I've been a dentist for about 3 years now. So I guess we'll just start off with my intro. It's just me, Southern California, and yeah. So you guys are all pre-dental students, right? All in college? Okay, cool. So yeah, I know exactly what it's like. I remember exactly where you guys have been. Kind of sucks that you guys can't do too much in-person shadowing. So I think it's really cool that this organization over here has done this virtual shadowing thing. I think it's a great idea for such a weird time that we're living in. And I highly recommend any kind of shadowing, and I'll kind of get more into that in a little bit later. So kind of just talk about what we're going to talk about in this quick presentation. I'm going to talk about my education and kind of what kind of education you might want to get depending on what you want to do. I'm going to say what I do in the office, and then I'll give kind of general pre-dental advice that I'd give to maybe any generic pre-dental kid. I'm going to talk about a few of my cases that I've done so you guys can kind of see the wide scope that dentistry has to offer. And I'm happy to answer any questions at the end. And also, if you guys want to stop me anywhere in between during the presentation, I'm happy to stop and answer any questions. I know like sometimes you have a burning question and it really pertains to certain slides, so I'm happy to answer. So just stop me whenever. So me, I went to USC for undergrad. I think a lot of you guys are from the East Coast, so if you guys don't know, it's Southern California. Go Trojans. And then I went to UOP Dental School in San Francisco. For those of you guys that don't know, that's the only 3-year dental program in the country. Highly recommend it. Amazing school, depending on what you want to do. I wanted to be a general dentist that uses my hands and a really good general dentist. And I think UOP is one of the best out there for that. I came out of school feeling super confident, really prepared, and was really happy. Each school is very different, and each school is better or worse at certain things in dentistry. So you really got to do your research. I wouldn't believe any of the rankings you might see out there. It's really research the school, talk to students, talk to alumni, and see what kind of fits you. Finally, I did an AEGD residency after at UCLA in their Venice clinic. What that basically is just like a postdoc 1-year residency where I learned how to place implants and do really big surgical cases and kind of full mouth reconstructions. And that was an awesome experience too. And by no means do you have to do an AEGD or a GPR or whatever to be a general dentist, but it gave me some awesome experience and knowledge that I would have not gotten just in dental school. And again, if any of you guys have questions on that, I'd be happy to answer and elaborate on that. But it was really helpful. And also one thing, not all GPRs or AEGDs are the same. Again, just like dental school, you got to do your research because a lot of AEGDs or GPRs are a waste of time. They're basically a 5th year of dental school, which is why the hell are you going to be a student again for a 5th year? So research, and I'm happy to answer anything that I know for that. So a little bit for me, why I chose dentistry. For those of you that are on the fence about dentistry, you're not sure if it's quite for you, definitely find out if it's for you. If you love it, it is an amazing career. I love being a dentist. I'm so happy that I'm a dentist. I love what I do every day. It's affording me to do so many cool things. It's really a rewarding, like really we change people's lives. I mean, in a small way, just teeth, nothing too crazy, but it's really life-changing for a lot of people, helping them either get oral health or improving the aesthetics of their smile. I mean, it's seriously, I can attest to how I've seen lives change, and it's only been 3 years for me. 3 years after school, at least. So for me, it was the perfect blend of healthcare, working with my hands, working with people, decent living lifestyle. So yeah, great career. So if any of you are on the fence, hopefully that kind of pushes you one way, but it's also a lot of work. So if you don't love it, it's not worth the work or stress, I promise. So make sure you like it. Currently, my dad and I have an office together in Orange County, Dentistry at its finest. And then I work at another office as an associate a couple days a week as well. And that one's in somewhere else in Orange County, LA area, in Long Beach. And then I'm also planning on kind of buying or opening a couple more practices, hopefully in the near future. We'll see how finances go. So, general dentistry. Honestly, general dentistry can mean so many things. Why is it cool to be a general dentist? Because you literally can do anything in dentistry that you want to do as long as you have the knowledge, the expertise, and the comfortability of doing it. Some people like root canals and love doing root canals. You can do a bunch of root canals without having to be a specialist and instead of being an endodontist. I mean, some people only want to do root canals, and so maybe those people can specialize and become an endodontist, for example. But as a general dentist, you can do whatever you want. I love oral surgery. I love doing surgery. I place a lot of implants. I take out a lot of very difficult wisdom teeth that oral surgeons take out as well. I love doing extractions. I have a huge case all-on-4 coming up, which, if you don't know what that is, it's basically just replacing the entire dentition on one jaw, lower, upper, or both. It's awesome. So I'm doing that as a general dentist. I'm doing that in like 2 weeks. So I do a lot of oral surgery, love it, it's just fun for me. And then I really love cosmetics because, like I said, it's life-changing. I don't know anything else that you can literally, if everything allows, money, time, health, whatever, but I don't know anything else where you can, span of 2 weeks, have such a drastic effect on people. Besides maybe also some weird plastic surgery stuff. But yeah, it's pretty awesome. So cosmetics and oral surgery are where I go, but being a general dentist, you can do whatever you want. It's really cool. And obviously there's a lot of specialties and stuff, but that's not what I'm here to talk about today. So how did I get to this point? So like you guys finished undergrad, or finishing for you guys, so go ahead and get your degrees. I did dental school. Most are 4 years. I did the 3-year program, which was awesome. Saved a year. I came out. I was a dentist at the age of 25, which is pretty cool. And then you can be a dentist. You don't need to do anything else as long as you feel comfortable. Some people don't feel comfortable and they decide to do a residency or something. I felt comfortable. I could have worked no problem, but I found this amazing residency that really taught me a lot of things that I wanted to learn. And so I did an AEGD, but there's also GPR residencies, which are really great. Some are really great, at least. So yeah, that's another thing that you can do. But that's how I got to where I am. To get to where I am, you don't even need to do an AEGD or GPR. You can just do continuing education courses and whatever thing you want to learn more of. So instead of a residency, I could have just poured a lot of money into really good continuing education implant courses, for example. Another thing to do. I mean, I do those courses now, but like I could have done just a bunch of other ones instead of doing my whole residency. Or I know some people who are super lucky and just have incredible mentors that are willing to teach them one-on-one all the stuff they know. And then usually it's because they want to sell the practice to that person or whatever. But you can learn any of those avenues and they all can get to the same end outcome. It's just a different journey to get there and different comfortability and experience. So no questions on that. I'll just keep going. So yeah, typical day in the office. Hold on, let me move this video. All right. So another reason why I love dentistry is honestly, every day in the office is different. I mean, there is no same day in the office. I mean, once in a while, sure, but every day is different. You have no idea what's going to happen sometimes. You'll have one schedule empty, and then it'll just bunch of patients will call in with emergencies or whatever, or new patients, and you start off a big case that day. You have no idea what's going to happen, honestly. Or you'll have a huge, super packed schedule and patients will cancel, and now I'm going to the gym early or whatever. So it's every day is different. One day I'll be doing a bunch of root canals, another day I'll be doing a bunch of wisdom teeth, another day I'll be just doing fillings, or a combination of everything, or like a full mouth rehab case. So it's awesome. So if you like to not be bored, dentistry is a great career. My office, we like to do everything in the office that we can. So we don't like to refer out almost anything if possible. We kind of have like a one-stop shop. So you come, as if you were our patient, you come into our office, you have to get the cleaning at the office from the hygienist, you get the filling, crown done by me, root canal, if you needed that, I'll do it. If you need an implant, I'll be doing it. If you need a denture, I'll be doing it. Whatever else, veneers, sure, all of that stuff. So we don't like to refer out if we don't have to. We'll even see kids, even though I'm not super stoked on that, but we'll see kids too. But just my patient base, just here in Orange County, I'm doing a lot of implants, a lot of wisdom teeth, a lot of cosmetics, a lot of veneers, a lot of crowns, some root canals and fillings and stuff. I don't do too many dentures. I used to live in Washington State. I was doing a lot of dentures up there. Not so much here. Okay, so some advice for you guys. Like I said before, I touched upon it. Make sure you love dentistry. It's a sad thing that I have to say that, but you gotta make sure you love it. Don't just do it because you think it's gonna make a lot of money, because I promise you the money is not worth it if you don't like it. Make sure, don't do it just because you think like, oh, you see me traveling, for example, and you think all dentists can travel, or like we only work 3-4 days a week or whatever. I mean, dentists work so hard. I work a lot of hours too. I just never post that. Maybe I don't post that much about me working on Instagram. So people are like, do you even work? And yes, I absolutely work a lot. It's just not fun to like see me working all the time. So make sure you love it. And how do you find out if you love it? Best thing to do is go in a dental office, maybe a dentist that you trust, or your dentist. Ask if they're willing to let you shadow. I know COVID's weird, but a lot of people are relaxed on that. And if you don't feel safe, then maybe don't. But if you do feel safe or comfortable, then go for it. But definitely shadow when you can. It's so crucial. You don't know what it's like being a dentist until you see what it's like being a dentist. And then talk to dentists, people in the dental field, maybe hygienists, dental assistants, whatever. Talk to as many as you can and really get the best feel that you can. Ask any and all questions. I'm happy to answer any questions. I love helping pre-dental people, honestly, because it's really rewarding, and I was there and I was asking questions all the time. So make sure you know what you're getting into, because trust me, it'll suck when you're $200,000 in debt and you don't like what you do. So make sure you love it. I also highly recommend, if your college or school or whatever has a pre-dental club or an organization, join it. And if they don't have one, make one. And then that'll look so badass on your resume for applying to dental school. But whatever you do, in my opinion, join one. I joined one my sophomore year of college, I think, or probably sophomore year. And honestly, I learned so much about being a dentist through that. I got such a great experience that I would have never gotten if I didn't join a club. And next thing I recommend is make sure you have a well-rounded application. Pre-dental club is a great thing to add to your application, by the way, because in general, dental schools love seeing people who want to be a dentist, that actually show initiative. They're not too excited about people that maybe have straight A's, but show no enjoyment in dentistry. If you don't have any volunteering or shadowing, or any dental experience, the dental schools are going to be like, why the hell do you want to be a dentist then? Did you just like not want to be a doctor and you just decided to be a dentist because that's cool? And I mean, I know back in the day it was like kind of a cliche, like, oh, you can't be a doctor, be a dentist. It's not true anymore. It's just as hard to be in dental school as it is to get in medical school. I could have easily been in any medical school I wanted to. If I wanted to do that, don't want to be a physician. I think it's so boring. So yeah, make sure that you show interest in dentistry. And then obviously, this is needless to say, strive to get the best grades that you can. I mean, maybe don't party Monday through Sunday. Maybe just party on the weekends. Kind of balance. But don't stress if you don't have the best grades. It's definitely not everything. What's really important is being a well-rounded person. I can't speak for every dental school, but I know I applied just to California schools because I didn't want to leave California. I know all the California schools want good people and well-rounded people that happen to maybe have decent to good grades. I focus on the DAT if you can. I studied for like 2.5, 3 months for the DAT, studied my butt off and did pretty well on it. So I highly recommend studying hard for the DAT and doing the best you can. Again, it is not everything by any means. They look at the whole application. It's just a lot easier to get into school if you already have the good grades and then you have a nice application too. Boost your application for dental school with work or volunteering. So don't just be a bookworm. Work in your summers. I mean, make some money for yourself, first of all, but then also show that you're doing stuff with your time. It doesn't even have to be a glamorous job. I was scooping ice cream at Haagen-Dazs. By the way, best job ever. But just work if you can, or volunteer. So I would, like, in the summers, I'd work at Haagen-Dazs scooping ice cream between college years. And then I go volunteer at the dental school doing like dental clinics for low-income areas. So volunteer in the dental field if you can. And if you can't find any, research, I'm sure you will, or your pre-dental organization can do it, or ask your nearest dental school. I'm sure they have a lot of volunteer work available. And then I can't stress this enough. It's so important. I know mental health is like a big hot topic nowadays, but I've been saying this forever. Make time for yourself. Life's about balance. Don't kill yourself over school. It's not the end all be all. Nothing is worth it if you're not healthy and happy. So make sure you're happy. Make sure you're healthy. The rest will come along. Super important. I can't stress that enough. I'm such a firm believer in that. Make time for yourself. Whether it's like an hour a day to go to the gym or yoga or read a book or play video games or hang out with your friends or just sit there and drink wine or watch TV or just sleep, whatever. Make sure whatever you do, whatever makes you happy, if it's a hike or eat or travel or whatever, make time for yourself. School isn't everything. Okay. Sorry for the long lectures on everything. Before we get started on cases, are there any questions that maybe are burning that you guys want me to answer before I just keep on rambling here?
I don't have any. Does anyone else have any questions? I don't think so.
Okay, I'll keep on going. If you have any questions at the end, I'm happy to answer. All right, so I have like 6 of my cases. I have a lot of cases. I just figured this is a good mix of a bunch of different stuff that's really cool, that I think is cool. And if it bores you, I'm sorry. I'll try not to be too boring for you guys. Here's my first case. I really like this case because it's a nice, really well done, in my opinion, veneer case. 10 veneers, nice natural look. Patient was ecstatic. I mean, I wish I can't put videos on this, but I have like the reveal video, and she was just crying in joy. And she still texts me saying how happy she is. So this patient over here, she hated her little teeth. I mean, you can see they're tiny. And if you look at her full face photo, they even look smaller. It just did not fit her face. She's a beautiful girl. But she just hated her smile because it made her look too young. And I completely agree. She wanted a little bit of a wider smile too, a little bit fuller and brighter. And when she first came in, she just wanted to do these front 4, maybe the front 6, canine to canine right here. And also, if I talk dental terms and I forget that I'm talking to pre-dental students that don't know dental terms, I apologize. Just stop me and I'll explain. But canine right here, canine right here, she was thinking maybe 4 to 6 veneers. And I said, yeah, we totally can. And you never tell the patient what to do. Just point out things and then let them decide. And I was like, but honestly, you won't be too happy with the result, because once we fix this and make this full and bright, all you're going to notice is the dark space right behind here, how it just disappears behind the canines. What I did is I did a mock-up. I threw some composite on her teeth, just really quick, maybe 40 minutes from her second premolar to her second premolar, where her smile shows. And I was like, just see what this looks like. And she loved it. And so that's right there. I didn't need to sell a thing. It was just, she's like, I see why we need to do 10, not just 4 or 6, because it won't look great. And here we are 10 veneers later. She's got a bright, beautiful, and I still, in my opinion, this looks very natural. If you didn't know these were veneers, you might not think they were. You think it's got a nice, perfect smile. And yeah, so I really filled out her smile, closed the gaps, gave her a more mature look, which she wanted, and it wasn't like a chiclet white in your face. But yeah, overall, looks great. Patient's happy. That's what matters. Next case. So this was one of my biggest cases in my residency that I did. I love showing this because I want to show you what you guys can do, not just after dental school, but either maybe in your residency. And I'm going to show a case I did during dental school that you can just see what you can do. So by no means is this case perfect, but patient didn't have money for perfect, so we did good. As you guys can see, she has an underbite, and what that means is her lower jaw is slid forward and she is biting on her front teeth. You guys can't tell, and I have more pictures, just didn't want to get too graphic here, but these are all rotted teeth, rotted molars and premolars. They're down to the gum line. She has no back teeth here. This is a broken canine, needed to go. Broken down tooth here. And then obviously all this severe chipping and wear in her front teeth. She had a collapsed bite, so on and so forth. So we actually opened her bite. I extracted this tooth right here, did implants here, and so forth. Obviously, not the shade match is not perfect by any means. Couldn't get it because she had so many damn colors going on in her mouth. We have to just kind of decide, and material choices for whatever reason for strength. But then we crowned. I think I did an implant also. I think one of these, either this canine or this canine, were also hopeless. I had to extract that and do an implant there as well. So I can't remember which one now, but one of these canines is an implant, and then crowns, and then I rounded out these lower teeth just so they're not chipped everywhere. And this is a huge difference. I mean, she would not smile before. I mean, who the hell would smile with these? I don't even know what you'd call these pegs. Now, at least over here, she's got a presentable smile that she can chew and eat on. I can't stress this enough, how important eating is. This patient is diabetic, needs nutrients. She couldn't eat vegetables because literally her teeth, she didn't have teeth on the back to chew on. She's chewing on front teeth, and you can't grind up and stuff real crunchy food. Now she can. She's got a full set of teeth again that she can eat on, and so forth. Right when we delivered this and finished this case, now she wants to do the bottom and transform the look at the bottom. Try to convince her at the time. The patients don't believe until they see it. So once she saw the difference, now she wants to invest the next 12 grand or whatever on the bottom to fix that. Unfortunately, I finished my residency, so next resident got to do that, probably her bottoms. But yeah, so I just rounded it out to make it look a little cleaner at least. But in my opinion, this looks pretty awesome. At least it's a huge improvement at the very least. Okay. Next case, I also did this in my residency. Super cool case. This guy's James. He had an accident. I think he fell on his bike, if I remember, and he ended up losing his front tooth. This is a fake denture tooth. We call it a flipper, that he had to replace the tooth. You can see the little clasp, the silver right here, these little metal clasps that go on the teeth. And just obviously doesn't look good. He doesn't have a front tooth. This is a fake one. So what we did was, and then he was like, we're already working on him, so he kind of just wanted to fix at least his front teeth. So what we ended up doing was an implant here, because missing this tooth. We did a crown on this tooth because it's very difficult to match the two front central incisors. So you almost always, if the patient allows, crown / veneer both of them at the same time. It's really hard to do just one. You can, don't get me wrong, it's just aesthetically doesn't usually work out too well. And I think we ended up either whitening the incisors here or doing really conservative veneers. I can't remember at the moment. But either way, look at the huge transformation from this to this. And I mean, you will be hard pressed to look at this smile and tell me that these teeth are fake. I think it blends really well, especially just looking at them naturally. It looked damn good. It took me a little while, but it was a really good outcome. So small things, implant, crown, done and done. All right, this I want to show because I did this in dental school, and this is such a good outcome for a student. You can do cool stuff in dental school. So my patient here, you can't tell in this picture, but her two front teeth are inverted, pointed to the tongue, the lingual side, so they come in. So her two front teeth, they'd go like this way, two different directions. It looked awful. She had a bad accident as a kid when she was 8, when she hit her front teeth. And then they died. She's like 30 now, and they died and they needed root canals, and they just discolored and just looks awful. So with some work, we did whitening on her front teeth, which had a nice drastic outcome. She's got good oral hygiene, so whitening just brightened up her smile. And then we did 2 crowns on the front teeth here that match her teeth super well, blend in amazingly. And then she can't tell here, but she had pointy canines that she did not like, and some pointy premolars. She thought it made her look too masculine. So I kind of rounded out all her teeth there, that it let the smile flow in her lips, in her lip line right here, and just gave her nice subtle changes that really made a good outcome. And she was ecstatic. And I was super proud of this case. As a dental student, I'd be proud of this case now. So yeah, you can do cool stuff in dental school. Make sure you got good professors, and you can see what you can do. This is just something super quick I did. An emergency patient fell on his face, chipped his front tooth. I had never met him before. Did this in like 30 minutes, 45 minutes, maybe an hour if I was trying, I can't remember. And I just did an emergency. And this is an emergency if you have a chipped front tooth. That's an emergency because who the hell wants to walk around like a hillbilly here? I ended up doing, this is all fake, just composite bonding. I threw in a little bit of white composite to kind of match his decalcification. As you can see, his other teeth here are so decalcified. I did my best to kind of match that decalcification with the white here. These teeth are dehydrated right now. As you can see, the white is much more apparent down here than it is here, because this is after an hour of me working on him. Once these rehydrate after a day or so, it'll look just like this again, and this will match. This matches really nicely to here. I just couldn't get an after picture a day later. And then I did not do this crown. This is some old crown that was not me. Looks awful. So just want to point that out so you guys don't think I did that. And my last case, just did this, I just finished this last week. Obviously huge difference here. I wish I could show some of the surgery photos and everything, but basically guy had a bridge from here to here, which is huge, that snapped and broke. He had decay everywhere. His teeth are just rotting away. He's got both crowns that are broken down. My camera was broken, so I had to use my iPhone for these pictures. So sorry for the poor photography here. And again, by no means is this a perfect case, but I thought, again, for what we had, it's awesome. I ended up putting an implant here, implant bridge here. He had a tooth rotting away back here that I took out. You can't see because it's just a root tip. Took that out, did an implant there, and then replaced all these crowns. So crowns, and then this is the bridge. You can't even tell it's an implant bridge. So implant to implant, and then crowns. Pretty awesome outcome. Now, since he's seen how good the top can get, now he's ready to do the bottom. Now he's ready to fix the bottom over here. It's super common with patients. It's annoying, but it's usually a large investment. So it's kind of hard to tell someone to drop 25 grand, 30 grand or whatever at once. So usually once they see the top, sometimes they want to do the bottom, and he wants to do the bottom now. So we'll see what we can do. Maybe Invisalign to straighten the teeth first and then fix the broken crowns here. We'll see. But yeah, super awesome outcome. Drastic transformation. This guy went from no freaking teeth looking like a homeless guy. And he's super nice. He's such a nice guy. But he looked not presentable at all. I mean, thank God he had to wear a mask everywhere the last year. But now he's got a smile again, so that's pretty great. That's all my cases. Thanks for having me. If you have any questions, let me know. If you want to find me on Instagram, you're welcome to. Ron Ayzin. It's not a very dental-focused Instagram. It's a personal Instagram. I do throw a lot of dentistry on my stories, and sometimes I'll post some dental stuff. I don't like to annoy my friends with dental stuff, so I kind of leave it that. But it's a personal Instagram. And then my office Instagram with my dad, he kind of runs a little more than I do. But that's our office Instagram, is Dentistry at its finest. You're welcome to follow. If you guys have any questions for me after this, maybe you were too embarrassed to ask now, or just didn't feel like asking now, or didn't think of something, you're welcome to message me on Instagram. I respond to the Ron Ayzin one. I don't respond to the Dentistry at its finest. My dad does. So if you want to talk to me, you can find me on Instagram, DM me, or email me. Either one. I check my email probably once every 2 days. So if I take a little while to respond, just bear with me. I promise I will respond to any question or message that I see. I don't know how fast. I respond usually quicker on Instagram, but whenever I can, I promise I'll answer any and all questions. Just let me know. And thanks for having me, guys.
Thank you for the presentation. It's absolutely amazing. Really appreciate it. We do have a list of questions we got from Instagram, so I guess I can just ask that one at a time, and then you can just answer.
Go for it.
Okay. So the first question I have is actually from your PowerPoint slide.
Okay.
And when you were talking about the AEGD and the GPR and CE, could you explain that? What that means, and are those exams, or how does that work?
Yeah, totally. So AEGD or GPR, it's another application that you have to apply to and get used to applying and doing all this stuff. And also, by the way, before I keep going, I will answer any question extremely honestly. So if you want to know, I promise you, I'm probably one of the best people to answer. I will not sugarcoat an answer. I won't tell you that dentistry is the best thing in every way. If you have any real questions, I will give you real answers. So might be a little blunt, might cuss once or twice, but I promise it's the truth. So it's at least my truth. Anyways, AEGD or GPR. Applying for that, you apply for it usually in your I think it's your last year at dental school. And it's a personal statement, it's your grades, it's some of your extracurriculars, and you're part of a club or whatever during dental school. And then it's an interview, and then you get matched. So it's a match program where you rank your top programs, and then they rank you, and they kind of match you together if you get in. And then an AEGD is usually more general practice kind of focused. Not always. Again, every program is so different. But in general, and then GPRs are usually more hospital based. So if you want to do some kind of like hospital dentistry, that's kind of where they are at. It really depends. Does that answer that question?
Yeah, absolutely. Yeah, it makes sense. Thank you.
Cool.
So you mentioned, which I thought was very interesting, how you went to a 3-year dental school. So and I personally haven't ever heard of people going there. And so how was it harder than maybe going to the regular 4-year dental school? And do you recommend it a lot, or is it just for certain people? And what's super beneficial about that?
Okay, so again, I'm gonna be blunt. Again, I have not been in a 4-year school, so I can't tell you. But after doing dental school in 3 years, I literally don't know why it takes 4 years to do dental school. I think it's a waste of time. I will say the first year is very gnarly at UOP. They basically combine the first and second year of other dental schools at UOP into 3 years, into the first year. So that's why it's 3 years. At UOP, you have a handpiece in your hand day one. You're in the sim lab drilling, practicing. So UOP is, I guess you guys don't know about it very well, but on the West Coast at least, and then dental field especially, dentists know UOP is known for making dentists that are good with their hands, because we are using handpieces from day one. What UOP is not so good at is kind of research slash knowing the book stuff as well as a lot of other schools. For example, UCLA is highly regarded for amazing research, groundbreaking stuff. The students know everything about pharmacology and microbiology and all that kind of stuff. I thought that was boring as hell and useless as a dentist, as a general dentist at least. So not important to me at all. I wanted to be an awesome general dentist. UOP was perfect. I will say, if you want to specialize and become like an orthodontist or an oral surgeon or a pediatric dentist or whatever, UCLA is known for being a great feeder school into specialties. So UCLA isn't exactly known for making the best general dentists overall. Not that there are not amazing general dentists that come out of there. I know a lot of amazing clinicians coming out of UCLA. But just in general, UCLA is more known for, wow, I can't talk, more known for specialties. And UOP is less known for that. So UOP, the acceptance rate to get into a specialty is a little bit lower. Not saying that you can't become an oral surgeon from UOP, because I know a lot of my friends became oral surgeons or orthodontists out of my school, UOP, but it's just kind of the general trend. So yeah. As far as the 3 years go, first year is gonna be all didactics. Mostly in other dental schools, the second year is kind of when you get into your sim lab and you're practicing with a drill. And then your third year in most dental schools, that's when you're in the clinic treating real people and patients. But at UOP, it's first year you're in the sim lab day one, and then in the second year you're already in the clinic treating patients. So that's awesome. And then a whole year of your life less in school, to me, is amazing and vital, and one huge reason why I loved UOP.
Thank you. The next question we have is about letter of recommendations for dental school applications. So what would be tips to get a good letter of recommendation, especially right now? Obviously, we don't really have good relationships with our professors since everything's online. So what would be tips for that?
Okay, that is tough. I don't have a great answer for you in terms of letters of rec, since you guys are all in Zoom college now. So I don't know, unfortunately, in that case. I can tell you, if you know a dentist, try to ask them real questions. Try to ask them questions that show thought and that you're interested, and maybe build a relationship, because you're going to want a good letter of rec from a dentist if you can get it, for most schools. So that'd be my first piece of advice is getting a letter of rec from a dentist of some sort. Maybe if you're smart or lucky enough and can make a relationship with one of the dental professors in the dental school, that's a little bit forward thinking. That could go a long way if they like you. So something to think about. Hint, hint. As far as your professors in college, I don't have a great answer for you. I mean, if you're a freshman and this is your first year, maybe wait to get your letters of rec when you go back to school, your sophomore or junior year. I don't know. Or if you're a junior, hopefully you made some relationships during your freshman / sophomore year to get those letters of rec. I can't imagine building a real relationship with a professor over Zoom where they could actually write you a real letter of rec. I will tell you, don't get shitty letters of rec. So don't just ask a professor because you need a letter of rec, because their letter is going to be generic as hell. The schools will know the professor. If you don't see their letter of rec, by the way, most of the time, unless the professor wants you to see it, but you don't see it. So the letter they could literally say in their letter of rec, and I've seen it before, where they're like, I actually didn't know student Michael, but he asked me to write a letter of rec and he's a nice guy. So I thought, why not? So seems like a nice kid. But like, that's a horrible letter of rec. So make sure when you ask a professor for a letter of rec, ask if they're willing to write you a good letter of rec. Not that they're just willing to write you a letter of rec. There is a big difference between the two. That's a pretty vital piece of advice.
Yeah, thank you. Let's see. For you personally, what was like the hardest part of dental school? Because I mean, it is obviously very hard, but was there something specific that was the hardest? And then like going along with that, what would be like the easiest thing maybe, or like your favorite part or something like that?
I don't know if there was an easy part, to be honest. I mean, it's not as bad as everyone says. It's a lot of work, but it's not that bad. I will say, for me, the hardest part was just, especially my first year, it is 20 times harder than college. If you guys think college is hard, just wait till dental school. Way harder. And that's not to scare you, because I promise you, and we can all adapt. I did it. Hundreds of people before me did it, and hundreds of people after me are doing it. We can all do it as long as you want to do it. But just know, you might not be going to those college parties on Thursday nights and wine Wednesday on Wednesday. You might only go out that Friday night, one night, and then Saturday you're probably studying again. At least in the busy year, not all 3 years, but at least in the hard year. Every school has 1 year where it's hell. UOP's first year, UCLA, their second year is hell. I know Michigan, their second year is hell. USC's second year is hell. So kind of depends, but every year, every school that I know of has 1 year where it sucks. So at least expect that. For me, the hardest part was the balance between going to the sim lab and working on my hand skills and like practicing preps versus finding the time to study for my didactic courses, for my microbiology, pharmacology, whatever classes. So in that respect, I think dental school is so much harder than medical school, because all they do is just study books, which just sounds boring to me. But in dental school, we have to study very similar material at the very least, and then spend hours and hours and hours in the sim lab practicing with a drill or whatever you needed to do, or waxing up a tooth or whatever. So that was the toughest part for me. I will say it's totally doable. I would make sure I'd go to the gym 4 or 5 days a week, even during dental school, as my me time. Anytime I was like would be studying and I just would recognize that I wasn't reading a single word from the textbook, or if I was in the sim lab for like 3 hours, 4 hours, 5 hours, and I was realizing that I was like screwing up every prep, I would drop it and then go work out and then maybe come back or whatever. I will say there's still time to have fun. My last year at dental school, I was living in San Francisco and I just explored all of San Francisco. I had a blast. I actually loved dental school. I had so much fun. just exploring San Francisco. I had a lot of great friends out there. I was going out every weekend my last year for sure. And even during the weeknights I was going out. Once you kind of find that balance. So there's good, there's bad. Just be ready to work.
Thank you. So like speaking about like getting into dental school, what was your major for undergrad, and was it helpful while in dental school, especially the first year when we're learning about like all the bios and stuff?
Sure. I will say your major does not matter. Pick whatever major you want, as long as you take the prerequisites for dental school. Excuse me. As long as you take like your bio, your chem, your physics, English, math, whatever you need for dental school, your major does not matter. Pick something you want to learn in college, because you're going to have to learn it, or you're paying for it probably, unless you have a scholarship or whatever, or parents are paying for it if you're lucky enough. You're paying for it, so learn something that you might actually want to use in life, or you just want to learn about it in general. A lot of my classmates were music majors or art history majors, and obviously most were bio majors or something. Personally, I was a neuroscience major because I love the brain. I actually find the brain fascinating. So that's why I picked neuroscience. I actually minored in entrepreneurship because USC has a great business program and a great entrepreneurship program. And I wanted to learn more about being an entrepreneur because, in my opinion, a dentist is slightly an entrepreneur. So that was what I majored in. I thought neuroscience was helpful for the DAT because I got super lucky on a lot of stuff, because there's for some reason a lot of neuroscience questions on my DAT. Not everybody had that, but for me it was, and I knew them all because as my major. So I got lucky. I don't think my major was that useful for dental school, except in physiology. When we talk about the brain, I crushed that. So I guess I got lucky. I don't know if it was exactly super helpful, but it was nice to have. But again, your major doesn't matter.
Okay, thank you. So speaking about like the DAT, how did you personally study for it? I know it was like a little while back, but how did you like study for it, and how, like, what would you consider a good DAT score? And I know like a lot of schools, they have statistics online like, oh, this is like a good score to get, and how like reliable is that?
Sure. Before I answer, is the DAT still out of 30?
Yeah.
You know?
Mm-hmm,
Okay.
it is.
It's still the same, because it's been 6 or 7 years since I took the DAT for me. So again, everyone's different, but I studied for about 2.5 months for the DAT. I happened to decide to do it the 3 months before I turned 21, or 2 months before I turned 21. So I actually spent my 21st birthday studying for the DAT. That sucked, but I made up for it, so it's fine, no worries. And I was studying for the DAT also during my year of OChem, so I also did not have much of a life that semester, but all worth it. It worked out really well for me. I did well. I took a Kaplan course, and it wasn't like, it was like a video course that I was like would zoom in, kind of like what you guys have now. But I took that, and it was like, and it would meet once or twice a week. And the reason I did that is because it was really helpful information, but it also made me do it and didn't let me procrastinate because I had to keep up with it. So it put me on a schedule. That's the number one reason I liked it. It kept me on a schedule, a doable schedule. And then the practice tests were super useful. So for me, Kaplan was great. I will tell you, I'll know a lot of other people who did a bunch of different things. Other courses like Princeton Review or whatever. I'm sure there's new ones now, since like 6 years later. But try to see what's like the best ones now. I mean, look at the reviews and everything, see what people that just took it said and how they did in the DAT. I do recommend taking a class if you can afford it and you have the time, just because it's helpful. And their practice tests are crucial. I mean, if you do nothing else, take at least one practice test that's like the real thing before you take the test, because it will surprise you. I know a lot of people really love DAT Destroyer. If you guys have not heard of that, it's just like some book. I think it's overkill. I think it's way too much information for stuff that you don't really need. So you'd be wasting. It's great information, but it would just take a lot of your time that maybe you might not want to invest in. So if you have a lot of free time on your hands, then sure do DAT Destroyer, but I think it's overkill. I know there's really good videos on YouTube, like Chad's videos or something like that. I can't remember the name anymore. I'm sure your pre-dental friends can tell you if you haven't heard of it, but there's really good videos on YouTube that explain all the science topics really well if you don't understand a certain topic. So if you don't know this one thing in OChem and you need it explained better, I can't remember the name of the videos, I'm sorry, but they're really good. Figure it out what they're called and get those. You don't need to watch every video unless you're bored, but like they're really, really helpful. They dumb it down in a way that's really easy to understand for any concepts you don't understand. And then finally, I just recommend like anything that you're weak at. Like I wasn't like that strong in biology just because I found it so boring memorizing all this crap. So I kind of went over my biology notes or some like I had some kind of DAT book that I read the biology section again just to like refresh my memory because it was a while since I took biology. So maybe if you're not good at chemistry or not good at OChem, maybe focus a little more energy on those subjects to kind of boost yourself up to balance everything out. Yeah, that's kind of my recommendations.
Thank you.
Oh, and then you asked what's a good score. Sorry. What's it called? That is very subjective, but and every school is different. I know some decent dental schools in the middle of the country that a good score is an 18 or a 17. I know in California that, if I'm going to be honest here, if you have a 17, you're not getting into any school in California that I know of, unless you have just an amazing application. And again, there are exceptions to every single rule. I know for UCLA, their kind of average DAT score was like probably 22, 23. And I know that's high. That's like not to scare you. But that also means that people in the 20s got into UCLA. Just an average here, okay? It's just, but know that if you got a 22, you have a decent chance of getting into UCLA, for example. I think UOP was the same thing, 22, maybe 21, but they cared more about the PAT, so they needed a higher PAT score to get, and that's like the spatial awareness part for the DAT, if you don't know, to get into UOP. I got a 24 on the DAT. I did really well. I got lucky because one of my reading comprehension passages was about neuroscience, and that let me really crush it. So luck favored me, and then I studied my ass off for that thing. But so it's not everything though. There's like, I know my best friend in dental school got like a 19, I think, or maybe a 20, and he got into, and so he's in the same school. And now he's gonna be an orthodontist. He was like top 5% of my class, and now he's gonna be an orthodontist. So just know, don't limit yourself because of your score.
Thank you. That definitely makes me feel better. Let's see, what other questions do we have? Within dental school, how common is it for people to like fail or drop out? Like, I know that's kind of like hard to say or tell, but is it a very common
No,
thing?
like I told you, I'm going to be super honest. At UOP, at my school, my year, 2 people dropped out and 1 person got held back, which is super embarrassing and awkward because his hand skills were just so bad. He really wanted to try it, but his hand skills were so bad that like the professors literally couldn't let him treat patients. So he needed he had to go through first year again, which I literally couldn't imagine. That was like the worst year ever. So I can't imagine doing that twice. He did it. Now he's a dentist. So yeah, some people fail. Some people drop out. And the people that dropped out were the people that figured out that dentistry wasn't for them. And that sucks. To go through it, any part of dental school, even the first few months of dental school, and then figure out that you don't like dentistry. They didn't fail. They didn't like drop out because they couldn't do dental school. I mean, at least UOP, for example, I don't know about other schools, but UOP really is good about building their students up. They're pretty selective with their students. And so once you make it in, they're doing everything in their power to make you succeed or help you succeed, I should say. So UOP, that was that. I know some other schools are known for a lot more dropouts. I think NYU is kind of has a reputation for a very high drop percentage. I don't have a good answer for you why. Um, most other schools don't have a high drop rate. I know UCLA has like one drop rate, and USC has like one or two drop every year, but like that's pretty much it as far as I know. So hopefully by the time they get into dental school, the application committee, the admitting committee or whatever, has weeded out the people that shouldn't become dentists. So dropout rate shouldn't be too high.
Okay, thank you for that. And then you were like mentioning hand skills, which are obviously super important because you're like literally working with your hands the whole time. So like, yeah. Since we aren't like in dental school yet and we don't really know exactly what we're gonna have to do, what are like tips that, or what can we do to prepare or practice before, like manual dexterity and stuff like that?
That is such a great question. I'm actually so glad you said that. It brings up a great point. So if you guys don't know, dentistry is very artistic. I did not know that. And my dad's a freaking dentist, and I didn't know that. But dentistry is very artistic, and I was not great at art in high school or college or whatever. So I recommend this to everyone now. If you have free time and have a free class to take or an elective, I highly, highly recommend taking an art class or like a ceramics class or a pottery class or whatever, where you're using your hands and you're doing some sort of art, drawing, building, whatever. Because I promise you, it'll make your first year at dental school much easier. The next biggest tip would be, if you can be a dental assistant as either a job or a volunteer, be a dental assistant if you actually want to become a dentist. Because all the people in my class that happened to be dental assistants before they were dental students were so much farther ahead than the rest of us, and we had to catch up to them, and they were like top of our class for the first year at least. So it'll make your life easier if you do an art class of some sort, or if you're already great at art, then you're going to be killing it. And if you can become a dental assistant to kind of get that background knowledge, it's a great resume builder. You can make some money. You can find out if you actually love dentistry, and you'll be so well prepared for dental school. So good big tips there.
Thank you. Okay, and then I think we have time for like one more question. And
sure,
it's just has to do with gap years. So did you like personally take a gap year? And kind of to follow up with that, what would be the pros and cons of taking a gap year, or like anything with that?
Yeah, absolutely. So there are definite pros and there are definite cons to taking a gap year. I will try to speak as best I can to both of them. I personally did not have a gap year. That's why I'm so young. I went straight from college to dental school and then dental school out. I'm more than making up for that now. I travel a lot now. Well, maybe not now during COVID, but before COVID, I was traveling a lot. And then even during COVID, I travel somewhat, at least around the country and a little bit out. But if you need to do a gap year, you need to decide if that's what you want to do. Why are you doing a gap year? Are you doing a gap year because you're burnt out from college and you need time for yourself or mental health, or just you need a break from school before you get back into dental school? Do it. Whatever is right for you, do it. If you feel like you need to do a Euro trip and travel the world for a year, hell yeah, do it. If you need to work, make some money to pay for dental school, or you want to have a little bit of a base, or you have a family or whatever, take the gap year. Dental schools will ask or wonder what you were doing during your gap year, so try to make that gap year useful. So if you took a gap year because your grades weren't good enough, you need to do a post-bac, or if you need to take the DAT, show dental schools that you were working during that gap year. If you traveled the world and had fun, tell them that you traveled the world and you gained a lot of culture and perspective on the world, and you're a new person because of it, because you probably will be, honestly. Whatever it is, make sure you do it for you. I will say one con of doing a gap year is, well, two cons. One is you're going to graduate dental school a year older. Not a big deal as long as you make that year useful for yourself. And the other thing is, it might be tough for you to go from college to not studying or doing work or classwork, and then all of a sudden being thrown into the gauntlet of a crapload of schoolwork again. I know that it would be tough for me. I sure as hell am never going back to school, or I can't say never, but I'm not planning on it. So I can't imagine going like doing more schoolwork now after being off for so long. So for me, I would imagine that'd be tough after a gap year, especially if you travel the world and had a blast. Might be tough to come back to real life. A pro of not taking a gap year is I'm a year younger. You can start earlier. You're ready. All the science that you just did in college is still in your brain and you remember it. And so class is a lot easier for you. And so you're still in kind of that schoolwork mindset zone where you can handle it. And yeah, I think that's kind of the main pros of doing a no gap year.
Awesome, thank you. So I think that's all the questions for now, and especially right on time. So thank you so much once again. We really appreciate it, especially like all your blunt answers. Like that really is helpful for us pre-dental students. So yeah, if
cool. Well, I appreciate it. If that's everything, thanks for having me, guys. It is actually very flattering that you guys asked me to be a part of this. I'm super happy to do it. Again, if you guys have any questions for me later and want to email me or message me or whatever, I'm happy to answer. Good luck to all of you. Do the work. You're getting into an awesome field. It really, really is such an amazing career. I'm so happy doing what I do. I love being a dentist. Hopefully you guys will too. And good luck to all of you.
Thank you.
All right. Bye, guys.